Hi, my name's Oscar. I'm a pre-medical student that's hoping to go to university next year. So that was the main reason why I came out to Ghana, is to get that experience before I go into university for my personal statement, really. But there was a lot of me wanting to compare the hospitals in England with the hospitals that are here. And there's quite a big difference. Quite a big difference.
As part of my nurse training, I need to do a 4-week foreign placement. So I decided to come to Ghana because I've never been to Africa before. I really wanted to experience something completely different to the NHS, and so it seemed like the most sensible place to visit.
So the main difference that I can see with the hospitals here and the hospital in England is that there's actually an outside part to this hospital. Right behind me is the main building, and then there's a big corridor that goes all the way down when you have all the different wards kind of scattered about either side of it. So it's very open, which is nice actually when you're walking around. It's definitely nice for the patients, because a lot of patients like to sit down and like to walk around and get that fresh air. My best experience that I've had here is when I was working on the delivery suite, and a baby was born with too much licum in her airways. So licum is also part of the amniotic fluid. It goes side by side, and so we had to put an NG tube down into this baby, and we used a little syringe to pump it all out, and then it got to the point where it was only me and this other nurse that was there with the baby, so I had to do the resuscitation part with my thumbs on this baby's chest, and after a minute or two of me absolutely pooing myself, the baby turned out alright, and it started breathing again. So that was baby Elizabeth, who I have brought into this world.
So I've just finished my day at the hospital, where I work from 8 till 2 as a volunteer. This week I'm on the male medical ward, which is really good because you can see all the cases in males which are most common, like mainly chronic kidney disease, liver disease. It's all very common here in Ghana. I volunteer weekly at Lister Hospital, where I've been shielded. I've never even seen blood there. And so here, when you're literally thrown in and you're seeing all of these cases, you're learning so much, and all the doctors are so willing to teach you. Like, I can't explain the amount I've learned, and you get that clinical patient contact, which is the main thing that you really need as a doctor. So this experience has just been fantastic.
The principles of healthcare here are pretty much exactly the way they are at home. The doctors and nurses take pride in what they do. They want to provide the best care to their patients, the highest possible standard of care, much like we do at home. The only difference is the lack of equipment. They have a lot less available here, and so they have to make best use of what they have, and they do that very well.